Hey everyone, today I'm going to talk to you about asthma. My name is Antonika and I'm a doctor of Oriental medicine. And a few days ago, I met someone who was sharing with me, I've got asthma since I have experienced some negative side effects from a recent, cough, cold, COVID. I have had this persistent experience of feeling having more asthma attacks than usual, which was a condition that I had a long time ago, and all of a sudden it's coming up. Well, symptoms from childhood or from earlier in our years often will come up because of a new health condition. And today we're going to address asthma. Can asthma be treated with traditional Chinese medicine? And yes, it can be. In fact, traditional Chinese medicine is a whole entire system of 5 branches. And all these 5 branches are used in combination to help you get to the root cause and to alleviate those challenges that you're having, so that way you can bring your body back into balance. And so in traditional Chinese medicine, when we are working with the patient who is dealing with asthma, we immediately go to acupuncture. Why? Well, because acupuncture moves the blood, it moves the qi, it opens up the orifices. It has a lot of benefits to helping someone overcome acute symptoms. And so if you're looking for a really good Chinese medicine practitioner, if you're looking to, in your area, there's some really great places that you can go, like, for example, acufinder.com, or you can go to daolabs.com to find a holistic practitioner who uses acupuncture and who treats asthma. So when we're looking at asthma, though, we the first thing that we want to do as a TCM practitioner is we want to identify what the symptoms are and identify what the pattern is. There are 2 significant patterns that we look at in order to come to get to the root cause, and it's called wind heat and wind cold. The lungs and the kidneys are the most affected when it comes to asthma. So how do we treat this? Well, if you're having an acute symptom, then it's very important that you seek medical professional help, because we want to alleviate the symptoms so you become comfortable, but then we also want to prevent these symptoms from occurring in the future. We want to help you get off of your medication, and we want to prevent you from being on medication for a long period of time. So how do we prevent these things? How do we prevent staying on medication, and how do we get off of it? Well, from a nutritional therapy standpoint, which is very different from, what is it called? Dietary restrictions or seeing a nutritionist, there are certain foods that we want to incorporate into our diet. Why? Well, because these certain foods have therapeutic properties that are going to help reduce the symptoms, that are going to help bring balance back into the body, and also nurture the organs that are deficient. So in general, for those who are having asthma attacks or frequent asthma complications, consider consuming mild foods that dissolve the phlegm, because it's the phlegm that's causing us to have all of this, this obstruction. Foods that are going to reinforce the spleen. So what are they? So kumquat is a really great one. Kumquat is it comes from the citrus family. Turnip, mustard greens, tangerines, lotus rhizomes, and lotus seeds. But where do you get lotus rhizomes and lotus seeds? Well, you can get them from a Chinese Asian store, and you can add them to your soups. You can also consume things like Chinese yam and flat beans, but avoid at all costs raw, cold, fatty, or greasy foods, and those foods that have a very pungent taste. These are foods that will produce phlegm, like fish, prawns, strong teas, and wine. Now, I'm a wine drinker as well, and if you are, then you can add Pinot Grigio to your wine and make it more of like a spritzer. Or maybe even, when you're drinking tea, dilute the tea so it's not so strong, and it will allow you to drink more of that tea fluid throughout the day. So let's talk a little bit about the wind cold symptoms. If you've because there are 2 symptoms, you got wind cold and you've got wind heat. So wind cold symptoms will present as shortness of breath, white sputum, stuffiness in the chest, and cough with some phlegm or liquid coming up. On the onset of an asthma issue, you'll probably experience headaches, you have an intolerance to cold, and you probably will have a lack of sweating. And your tongue will be like a thin white coating. Now, your tongue is the microsystem of the entire body, just like the ears and the hands and the feet are. The tongue tells us a lot about what's going on internally. From the tongue, we can identify your digestion. We can see if you're suffering from cold or from heat. We can also see, if there's a lot of stress in the body or if there's a lot of stress on your mind, and how we need to shift these patterns so your body becomes back in balance. So if your tongue is white, then these are the signs and symptoms of a wind cold symptom. And if you're experiencing those symptoms, then we want to consider consuming foods like grains and vegetables, seaweed, which is very tonifying for the kidneys, legumes, legume soups, sprouts, herbs, microalgae. Now, I am a big believer of chlorella and spirulina, and I provide a very high grade, GMO-free, plant-based type of, greens that are going to support you through the process of helping you bring your body back into balance. Omega-3 oils are very important. Krill oil is one that is significant in, helping achieve balance with this condition. And then also small amounts of spices. Now, if you're the kind of person who loves to cook and you love to use a lot of seasonings, that's great. But we want to be able to use a small amount of spices. So I always recommend, when you're spicing up your food, to stick with a certain kind of spices. I always cook with ginger, a little bit of sea salt, a little bit of honey, and sometimes even an all seasoning. But you could choose to use things like, basil or cilantro, and always get them from fresh. Onions, these are also very great. They're tonifying for the lungs, and they're also tonifying for the kidneys. Other foods that you should be eating are foods like garlic, green mustard greens, like I explained earlier, and then fresh basil and ginger. Fresh basil and ginger. Basil is very easy to grow at home. Get a basil plant, put it in the sun or put it in the shade, and have that in your smoothies, have it in your soups, eat it over your pastas, put it in a sandwich. Very great for tonifying and cleaning up the blood. Fresh ginger. For some, ginger can be very, very warming. So if you have a constitution that's very warm, and you want to maybe give ginger a break. Other things like blackstrap molasses, very good for the blood, helps tonify the blood, enriches the blood, and almonds. Almonds are a great resource to have whenever you're on the road or you're on the go and you just need a little bit of, you need a little snack. Having almonds with you, sunflower seeds and walnuts. I have written a blog on the value of seed cycling. Seed cycling is when we shuffle through seeds like pumpkin seeds and chia seeds and flax seeds throughout the course of a month to help balance our hormones. And so as you can tell, seeds have a very high constitution of nutrients. They're loaded with omegas, they're loaded with oils, and they're loaded with fats that are going to feed our brain. And they're also really good for people who have asthma. Black beans and even oats are beneficial for people who are experiencing those wind cold, symptoms. Now, if you're experiencing wind heat is a little different. Oftentimes it will manifest as a wind heat, and then eventually you'll get to a wind cold. What we want to do is we want to alleviate the wind heat symptoms, and we want to reduce them, and then start treating the body with the right kinds of foods that are going to help balance out the body under the wind cold suggestions. And so if you are experiencing wind heat, that means that there's a lot of yellow phlegm coming up. You are hot. Maybe you're hot in the face, having a hard time breathing, and you're having wheezing. There's a lot of tension in the head. These things are, your tongue's going to be red. This is a sign and indication of toxicity in the body. And we want to alleviate the toxicity in the body as much as possible. Now, I'm a huge worker of detoxification. Almost every client that I work with, every person that I make recommendations to, I recommend we go through a detox. But a detoxification is other than what you might think it is, which means that you only drink water, or you only drink, certain things, or you only eat certain things, and then you have to starve yourself. That's not a detoxification. A detoxification, in my terms, depending on your symptoms and syndromes and signs, I will identify what kinds of things you want to have into your body and what kind of things you want to break away from for a period of 14 days. a period of 10 days, or a period of 30 days. And over the process of detoxifying the body, we are allowing our body to absorb the nutrients that we need from the foods that are helping us clean up our organ system, so we can stabilize and recalibrate our system. So it's a very beautiful process that helps us become more clear in our mental thoughts. And that's why many practitioners who practice detoxification say they feel more enlightened, because light, being food, is full of nourishment. It's away from the toxic food that we find in grocery stores or in restaurants or in fast foods. So the foods that are going to be beneficial for alleviating wind heat are things like juices, vegetables and their juices, having 6 cups of vegetable juice a day. I'm a big fan of celery juice. So I will juice a big stalk of celery, and I will juice 1 or 2 green apples, just to help me get past the taste of celery juice, and have that every single day for maybe 3 days or 5 days. And then also considering wheatgrass juice, really great way to clean up and hyperoxygenate the blood. Seaweed, again, tonifies the kidney, and then microalgae and spices and herbs, and raw sprouts. Raw sprouts, lightly cooked, are also detoxifying, and they help eliminate toxins. Now, after this broadcast, I'm going to quickly create a blog for you, and I'm going to leave the link right here in the comment section so you can have a look at what I would recommend as a recipe for you to help get you through these challenging times and to prevent these symptoms of asthma. Okay. Another thing I want to add is that, when we're looking at this type of condition, we are only right now talking about nutritional therapy. There are other 4 branches of traditional Chinese medicine. This nutritional therapy practice is something that you can incorporate right away, but it's not the only thing that we want to incorporate into our lifestyle. We also want to incorporate acupuncture. We want to incorporate things like gua sha therapy, or maybe even acupressure. These are using tools and things in our hands to help us get more results in between our acupuncture treatments. Another thing is herbal formulas. Oftentimes I'll make recommendations for herbal formulas that are going to help bring our body back into balance, in addition to using natural therapies. A few of the companies that I like to share with are things like Dow Labs and Wellum. They're really great resources that provide herbal formulas right over the counter that you can get, that are all natural, non-GMO, non-toxic. They are combined herbs that are going to help you achieve the result that you're looking for over a longer period of time. Another thing that I want to share with you is that Qigong, movement, exercise is very important. So if you have an opportunity to go for a walk, a brisk walk, or you have an opportunity to just do some very deep breathing exercises, this is beneficial for anyone who is having a challenge with wind cold or wind heat symptoms. Calming our mind and telling our mind how to function, giving our mind a chance to breathe, our mind a chance to just take a break, really helps our rest of our organs to find balance, because our mind not only dictates and directs how we think, feel, and do, but it also has a responsibility of controlling the involuntary workings of our anatomy. So I hope that you find this video helpful, and that you will share this with someone you know who is probably experiencing some challenges with asthma. My name is Antonika Chanel, Doctor of Oriental Medicine, and it is my pleasure to inspire you and to help you achieve optimal health. Thanks so much for watching, and I look forward to seeing you in the next video.